What we'll be covering in this webcast today will be essential, an overview of innovation. This is for the benefit of people who are not that familiar with innovation, so we'd like to make sure that your fellow staff and your stakeholders and yourselves, who's ever on the call, has a good understanding of what the innovation component, the Mental Health Services Act component is about, and that this resource will be available for you to share with others, because we'll be recording. We are recording, and we'll make it available on our website. So what we'll be covering are the essential purposes of innovation, the definition of MHSA innovation. We'll talk about the contribution to learning part of innovation, talk about the scope of innovation, the reason for your innovation project, innovation planning, innovation development, and then the time frame of an innovation, measurement, and then we'll get into an example. So we're going to go over the heart and essence of what is MHSA innovation. But we'll have time for discussion and your questions, and we'll also have a concrete example from San Bernardino. So that's what we have planned for you today. So let's move on to the definitions of what a Mental Health Services Act innovation. One of the things that's important to understand in terms of MHSA innovation is that the Mental Health Service Act specifies that funds are to be used for 4 purposes. So all innovation projects must fit one of these 4 essential purposes. The first purpose is increase access to underserved groups. Second one is to increase quality of services, including resulting in better outcomes, promoting interagency collaboration, and in general, increasing access to services. So all innovation projects fit in one of these essential purposes ideally, and there's some that might be able to fit in more than one. But ideally, there's one core essential purpose that you are trying to accomplish with your innovation. Now, what is a Mental Health Services Act innovation? The guidelines define an innovation project as one that contributes to learning rather than one that has a primary focus on providing a service. And this is a really big distinction and something that is a big shift in comparison to the other components. The other components of the Mental Health Services Act are designed to provide funding for the new kinds of services that the Mental Health Services Act promotes in community services and supports and in prevention and early intervention. There's funding for services that fit in the Mental Health Services Act transformational concepts and principles. But with innovation, the primary purpose of innovation is not to be another funding source for other types of services. And that's a confusion because of how the other components are, but also that people think of innovation is to fund innovative services, and that's how, when you hear the word innovation, that's how it's easy to think that this is an opportunity to use funding to be able to pay for something that is innovative but that hasn't been done that you don't have in your county. But really what this is about is this is to develop innovation, to incubate an innovation, to discover something, to innovate. And then when you've discovered that, then you will have something that you will use in other parts of your service system. So this is money to be used to try things out and test it out, and not for something as a proven practice and known to work, but is new to the county. Ideally, you would be using your prevention and early intervention funds or your community service and supports funds to bring in something that is innovative to your county, but that has been found to work and that people know that works and people know it's a good innovation. So if people know it's a good innovation, if they know that something is relatively new to the mental health system, but works, and there's confidence that's good, and people want to bring it in, then that's part of the heart of what the CSS component and PI components want. They want you to be bringing these good, known, innovative, transformative practices into your service system through the community services supports and prevention and early intervention pools of money. So this is not for bringing in an innovative service that you know, but this is to test, figure things out, and to innovate. Okay. Now, another key thing about innovation is that innovation projects must contribute to learning. So that's the other element of an innovation. So the first part is that it is not funding service, but it's testing something out, trying something out, experimenting. But the other part that really helps define what an innovation is this component that it's about learning, that you do an innovation to learn something. And there are three ways that an innovation project could contribute to learning, could help you learn. One of the ways is that it can introduce a new practice approach that has never been done before. And this means not just never been done in your county, as I was saying earlier, but never been done before, something that is an experiment that you want to try out and figure out whether it works or not. Another way, and that's how you contribute to learning, by finding out whether it works, how it works, and what you would need to know about how to make it work. And in learning that, then later you could bring that into your mental health system. Another way that an innovation project contributes to learning is that it adapts an existing practice or approach. And so you take something that is known to work, but you're going to try a variation on it. You're going to adjust it. You're going to alter it. And you're going to see if that works or what you learn about that adjustment. One good way of doing that, for example, or a common way that you might think of doing that would be if you want to test something out for a particular setting or community, say something that has worked in urban settings, and you don't really know how well, whether it's going to work in a rural setting, but you have an idea of how to adjust it for a rural setting. Then you would make that adaptation to this practice that has been known to work in an urban setting to see if your adaptation also then works in that rural setting, for example. Or for a particular community, you might take a practice that has been known to work for a certain community and adjust it, make alterations to it, make it culturally relevant and specific to a new community, and check that out and learn if that adaptation did result in the practice being effective for the different community, for example. Or you might learn what adaptations are necessary. So you might try out various adaptations to find the one that really works the best for a community. So that's the second way that a innovation project contributes to learning and is really driven by the desire to learn and an interest in learning. And then the third way is that you adopt a practice from outside mental health and you bring it into mental health. So something that has been known to work outside of mental health and bringing it into mental health is the third way that you could be contributing to learning and meet the definition of what is an innovation. So you don't know if it's going to work in mental health is the key thing about it. You don't know if it is, so you test it out and you check it out and see if it will work or not. And that's the third way. So in all of these, the general spirit of an innovation project is that you're doing it to learn something. Okay, so now innovation projects can be done to address many different areas of the mental health system. They are not just necessarily focused on service provision. They could be focused on other components. For example, you could be looking at innovation around planning processes. You could be talking about innovation around capacity building approaches. You might be trying out new capacity building approaches that you haven't tried before. Administrative processes or procedures, training and education practices and approaches, treatment and recovery practices and approaches, outreach and engagement strategies. So you have an option to use this innovation funding to really figure something out in your system that is different than anything that you might have tested out before. And so this becomes the place where you can really start driving change, future change in your system. Bringing in the Mental Health Services Act has brought a lot of transformation to the system, but to continue to be transformative, for the MHSA to continue to be transformative, it needs this dedicated funding for learning, for trying things out and discovering new things. So this is an opportunity to really find something out that you didn't know before, and an opportunity to then alter some part of your system, whether it's in services or whether it's in processes. And an opportunity to find something that hopefully will be more effective than what you had before. That would be the goal. But you can also learn and find out that things do not work well, and if you find that out, then that's okay as well. You find out that something is not working, and you've learned that too, that you've tried. So the spirit is on learning, and more than it is on any of the other elements. So to really develop a good learning project, an innovation project, it helps to think about what you're going to do with your learning once you have finished learning what you wanted to learn. Will you change how you operate? Will you fund a successful innovation with PEI, CSS, or realignment and leverage dollars instead of something that you're funding now? Or will you adopt a new policy? If you think about your question of what next, what would I do with the learning, that's another way of really helping frame your innovation project. And it not only clarifying what it is that you're learning and why you're learning, but also it can help you decide which project to do or not do. So if there's something that you're trying that might actually really lead to a change in how you operate, and it won't take money to change how you operate, you just want to know whether this process or procedure makes a difference, then that's something that is likely that if your project is successful, that it would be very likely that you would implement it, because you could change how you operate. You wouldn't need to find additional funding once you've learned what you wanted to learn through the innovation. Now, if you are trying a new practice or service and you're trying to see if that works, well, then you would want to be thinking about what would happen if it did work. Are there funding sources for that service or program if you found something that did work? And that could be a factor then in determining what you're going to be doing in terms of choosing which project you're going to innovate. Because if you have something that might seem very useful to learn, and then you learn it and you find that there's a service that really works, but you have no idea of how it would be funded after you've learned that it works, then you might end up putting time in finding something, but then sitting on the shelf, and then that might be disappointing to stakeholders, to the community, and to the county as well. So you would have to factor that in the planning process as in your stakeholder process as you determine which innovation that you want to do. You want to think about that, how it would be funded if it is a service afterwards. Would you replace programs with this new version if this is better, for example? And then policies. You know, if you're looking at learning about a policy, then you can see if there's a way that you could update your policy. And that should be pretty easy to do. So those are things that really help you think about your innovation further as a learning project, is thinking about what you're going to be doing once you've learned what you want to learn. Okay, so now I'd like to get into a little bit about innovation planning and talk about how some strategies for developing your innovation plan. So one of the things that is key is, let's start with thinking about the relationship to, we're going to start with the right side here of the slide, and we're going to talk about your relationship to prior planning, because this is an area that people have had a lot of questions about and they're unclear about. So certainly your planning process for innovation can be less elaborate than it might have been for some of the other components, because a lot of other planning has already been completed. So there might be some information that you can draw from the previous planning on community needs and priorities that could help inform your innovation planning process. But it's important to know that you still need to adhere to regulations for community planning. So you still have to have a community planning process and follow the regulations for the community planning process in innovation. And what's really important is that decisions that are being made in terms of what's going to be funded and what's going to be developed, that those are informed by the innovation guidelines. So when people were doing the CSS planning and doing the prevention and early intervention planning, there's a lot of information that might have been communicated in terms of what needs are and priorities and gaps. And so those can really help identify areas that might be useful for learning. You might want to learn how to address one of those gaps or how to address one of those needs. But the CSS and PI planning processes, people, in most cases, depending on when you did them, people did not know what the definition of innovation was. Most people might have been talking about wanting services funded, and since innovation is not about funding services, but it's about learning and having a learning goal, then the CSS and PI planning processes all by themselves are not likely going to be sufficient, for innovation, because your innovation planning process should address what the innovation guidelines talk about in terms of what is an innovation and what's the goal, and then your community members should help contribute to making these decisions. So, for example, thinking about what is the most important and useful thing that the community wants to learn, that your stakeholders want to learn, and what is the reason for this learning. Those questions, what is most important to learn and why would we want to learn it, are things that should be addressed in your innovation planning process. So although it can be much less elaborate, since you have a lot of information on what community needs are and gaps, you'll still want to have an innovation planning process that addresses these questions in terms of what do people want to learn, what is a priority learning goal for them, and what would they want to do with that learning. And then in general, for planning processes, you want to make sure that that you have participation of consumers and family members and people that reflect the county demographics, including underserved, as well as you had in the other planning processes for the other components. So you want to have their participation in making sure they have access to knowing what the learning is, 3 ways of contributing to learning, and in terms of helping determine, being part of the decision making and determining what it is that you will fund with innovation, what learning project you're going to fund. So when you do your planning process and when you write up, still pay attention to participation of consumers and family members and your county demographics, and pay attention to participation in actual decision making or contributing to decision making. And then lastly, as I've been saying, pay attention that your planning process includes people knowing what innovation is about and making informed decisions about what they want to do with the innovation. Okay, so now let's take a look at developing your innovation plan. The Oversight and Accountability Commission came up with a worksheet. It's called the Innovation Decision Path for Counties, and we will make these materials available with this webcast on our website, and you can contact either California Institute for Mental Health or the OEC if you want copies of this resource or other resources. But this is a resource that can really help planners as they're working through the process of identifying the learning goal and looking at how the community might present some of their concerns and how to help the whole process move through to reaching a fundable innovation project. So, one of the key elements in the decision path is to identify a priority issue to be addressed by innovation. Now, often this will come through your stakeholder process. Stakeholders will be contributing to all these steps, but it's the easiest thing to hear in any stakeholder process, both internal in the county stakeholders and community stakeholders, all your stakeholders. When they participate in planning processes, it's often the easiest thing to do is to identify what are areas of concern. So, and counties are going through different processes of sorting through those areas of concern or interest and identifying what are priority issues. So some counties have done an open process where people have contributed ideas of what they believe where innovation should go, and then a process of prioritizing those and finding the top priorities. And each county does that in a different way, but you want to get a sense of what your key priority issues are. Now, innovation in and of itself isn't meant to address an issue by funding a service. So, but this is how the community and stakeholders in general often will present in a planning process. They'll be talking about issues. So that's good. So how do you convert that into a learning goal? Well, one way is to think about what are existing barriers to solving the issue. Why hasn't this issue been solved? Why is it still an issue? When you look at that, you might find various reasons. Now, one of the most common reasons that presents is that because we don't have funding to do this X, Y, and Z that we believe that needs to be done. If that is the main barrier for a priority issue, then that is not an appropriate project for innovation. And the reason is, if funding is the main barrier, then innovation is not about funding a service or a program. So it would be inappropriate to, it wouldn't do the need the justice to try to meet it, funding with innovation, since innovation is focused on learning. And so if so you would want to find something that your barriers are something else. So barriers could be anything from not knowing how to, or not having found something suitable, or to meet certain needs. And so when you start getting deeper and you start finding barriers such as those, like not knowing how to address that need, you've tried but you haven't been able to, you haven't found something appropriate, that's when you start finding things that can lend themselves to a learning goal. Because then you can ask, for learning goals, how could I serve this population better if everything else that I've tried doesn't work? What is a method of serving this population? What is a method of engaging with this population? What is, because the others haven't been working, we still haven't been able to provide services to that population like we wanted to. So you want to turn your goal into your priorities into learning goals, and think about, from what you're hearing in the planning process, what is it that you could learn that could really help address that barrier? So if you learned a more efficient process or a more effective process, or if you learned a practice that actually did achieve the outcomes that you're looking for, then that would be a way of addressing that barrier. So you would want to learn these things that then could really help solve some of these priority issues that your community has. So this is going to be an incubation for figuring out ways of addressing some of these needs. But it isn't a source of funding to directly address a need by funding a service. Okay, so once you found out what your learning goals are, or been able to take what has come up in the planning process and identified some learning goals that would really help address those issues if you learned what you wanted to learn, then you can think about what practices or approaches there are that you might try to test out and to solve that key issue and achieve that learning goal. So if you're trying to find a more efficient, a more effective process for engaging with a particular community, then that's your learning goal. How to effectively engage with a community, and then there might be some things that you might want to test out that you don't know will work. And what's key is that you don't know that it will work. And that's where it's different than funding a service. If you know it will work, if someone tells you, to serve this community, the way to do that is to use these community members as part of your service system, then you have an answer. You have an answer that's probably been shown to work in other places. And so then that is something that should just be funded with PEI or CSS. But if instead you don't know how to serve that community, and you want to test some strategies that you're not sure are going to work, then that would be a practice or approach that you would be testing out. So I presented this as a linear, and this graphic shows the arrow and it's linear, but really in the plan development process it's not going to be that linear. People will be trying to propose solutions to you and practices, or you might have solutions, people might have solutions. And so the key is to think about that. If it's a solution that people know will work, then it's not a learning goal. If a barrier is that there's a lack of funding and people just want funding, then it's not a good innovation. It's not an innovation. So you're playing around in all these four boxes, trying to find approaches to test that really relate to something that you really want to learn, that can help address a learning issue that's a priority, that might address a barrier. So hopefully this way of looking at how to develop an innovation might help with the process on the ground when you're working in the plan development process. There are also some other resources that we've developed. One, at CIMH, we developed an innovation project development worksheet. And that one's organized around specific questions to answer as you're developing your plan, and to help you turn your planning into, help kind of confirm and check and help you think along the lines of the innovation component guidelines. And then when you're writing up, you definitely want to see the OEC's Innovation Work Plan Description Success Top 10 list, because it's a top 10 list of what a great work plan description, a written plan, would look like. So if you go through that top 10 list, that can really help in terms of putting your innovation to paper and submitting it. Okay, now a few more items we want to talk about here. I'd like you to know about that. There's think about the time limit for an innovation project, and this is flexible, and it reminds me a little bit of about the discussion about what the speed limit is in Montana, where people say there is no speed limit, but there actually really is, and the speed limit is driving as fast as you need, as is safe. So same with, in a sense, with innovation, that there is no specific time limit, but there is a time limit, and the time limit is how long do you need to for your learning goal, which is the purpose of what's driving your innovation. So how long do you need to demonstrate whether whatever's new about the innovation works and whether it can or should be replicated? So so again, if you think about this as testing something out, as experimenting, as finding something out, as discovering something, then you want to think about how long it will take for you to figure out what it is that you want to figure out, learn what it is that you need to learn, and disseminate that information, and finalize your learning to a point where you're ready to replicate and could use this, what you've learned in other either programs or practices or approaches. So there are a lot of elements that can fit into how long it takes for you to demonstrate whether what's new about your innovation is working or not. And so that's what we have in the boxes below is some ideas in terms of what you can be thinking about in terms of building out how long you need for your innovation project. It helps if you think about who you need to include in the learning so that you can have a sense of how long it might take for each of these participants in the learning to go through the learning process. So getting clear about who you need to include in the learning is one step in terms of thinking about how long you need. You'll need time to develop the measures for your learning goals. In general, when you're doing your plan and submit your plan, you might have some idea you should have some idea about what it is that you need to learn. But one of the things that's important in your learning time is that you're going to need to actually construct the measures and have the measures ready before you implement. So calculate some time, not just on figuring out who all needs to be involved, but figure out, allow for time that you'll need to actually develop the measures for the learning goals and get them set up before you implement. Then you'll be doing implementation, and you'll want to be having cycles of implementation and collecting findings, analyzing them, and making adjustments. So you think about how much time it's going to take to implement the project, test it out, and continue implementing until finally you think you've had all the time that you need to really understand whether or not what you've tried out that's new, whether it's new from outside or whether it's a new adaptation or it's new to mental health, period, whether it's working or not and how it will work and how or whether it should be replicated. So once you've done that, figured out how much time you need in terms of implementation and analysis and adjustment and implementation, you still want to include in your time frame thinking about how long it's going to take for you to report your findings and your recommendations with replication in mind. So since this is really the generator of true changes and transformation in the future of the MHSA, it's really important to think about sharing what you've learned and coming up with recommendations and strategies for replication with your community and with the state. So you will be asked to do a report at the end of your innovation project. So you'll want to include in your time frame the time that it takes to not only generate a report, but to really communicate the results and lessons learned locally and statewide. Okay, so one of the things to be keeping in mind in terms of your time frame for the project is this is what we're talking about is the time frame for how long it takes for you to do your total innovation project. At the end of this time, then your innovation project is over, and then you it can start a new innovation project or more than one, depending on how much money you have available and your planning estimates. And so one of the things that's important to note is that this time frame could and might go beyond the time frame that you have in terms of your planning estimates, in terms of reversions. So your project might outlive the planning estimate for a particular year. So when you're doing your innovation project, just keep that in mind, that your money in innovation still has to be spent and used within the reversion period. So a particular project might go beyond a reversion period. It doesn't have to be limited. Your project doesn't have to be limited to the 3 years, but you want to be keeping in mind the funds that you're using for the life of the project, and make sure that they don't become susceptible to reversion. So keep that in mind too in terms of managing your funds, that your project might go much longer than a certain set years planning estimates are available. Okay. All right. Let me talk briefly about measurement. And the key thing to understand about measurement in the innovation project is that measurement should be focused on your learning goals. That means that the purpose of measuring is to learn what you set out to learn. So your measurement in innovation, what you're going to be really trying to do is to focus on what is new and changed, and see whether that is working well or not. So it's not quite the same as a service measurement, although it could include service measurement. But if you're funding a program or you're funding a project under PI, CSS, then you're typically going to be focused on your outcomes and wanting to make sure that the project is meeting the needs of your community, which is usually going to be in terms of specific either prevention outcomes or early intervention outcomes or treatment and recovery outcomes. So you're evaluating your programs around those outcomes. When you're doing an innovation, you're not thinking necessarily about that, although you could be. What you want your measurement to be focused on is your learning goal. So if you're trying to learn whether a new process is more effective for engaging with a particular community, then you would set measures that would try to find a way of whether you are being more effective at engaging the community. And that's different than that would be a process outcome and not necessarily a service outcome, treatment outcome, or prevention outcome, early intervention outcome, or recovery outcome. So another way that might help you understand how you can write your measurements for innovation is to think about how decision makers will be able to determine whether the new or changed practice will be implemented and become part of how the county delivers its services. What will decision makers need to know about your innovation? What will they need to know about this new process or this new service that you're testing out? So, of course, that could include service outcome data, but they might also need to know other types of information that are related to that learning goal. So when you write up your plan, one of the things that the reviewers have found is that a lot of people are taking the section on measurement as a standard program evaluation, outcome evaluation, service evaluation, and they're talking about all the measures that measure that they're going to do, the outcomes that they're going to be measuring related to the services, and that is fine to talk about that. And you can talk about different aspects that you want to evaluate. You can evaluate everything, but we just want to help everyone recognize that they don't need to evaluate all those other elements unless they want to get additional information or unless it is tied to a learning goal. The key is, what do you need to know about your learning goal from what you're going to be doing to help you know whether it's working or not, you achieve your learning goal. And that's all you really need to report in your plan that you submit, is the measurement that's related to your learning goal. Okay, so what I'd like to do now is take a pause and have a chance to address some questions that have come up. So I'll be addressing the questions that have been sent to me. So far, there have been no questions about the content. So feel free to go ahead and type in a question now. Let's take a little time and see if there are any questions on anything that I've covered so far. Okay, it doesn't look like I'm getting any questions. Okay, there we go. Okay, so the first question we have is, how much of the measurement do we put in the plan when we will be developing this after the plan is approved and before implementation? So how much of the measurement do we put in the plan? Okay, because you'll be developing this further after the plan is approved and before implementation. A good question. Okay, so the question has to do with measurement. If you're going to be taking some time to develop your measures, once your plan has been approved, to develop them further, are you? How then can you describe that in your plan? And the key to the measurement in the plan is to just to give more general description of what it is that you're going to be looking for. And so what reviewers are looking for is, what are you thinking about that you'll need to know to learn what you want to learn? So when you answer that question, you can talk more generally about what measures you might be looking at, or what the types of measures that you'll be looking at. You don't have to actually have developed the specific measure and say, we're going to be using this instrument or this specific tool, although you could if you've already thought about that. But what you do want to say is, this is what we will need to measure to learn what we want to learn, and we will develop tools to measure that. So if you're learning about going back to the example of a process to improve outreach and engagement, then you'll say, well, then we'll develop a measure to see whether this process is more effective than what we've been doing before. We'll be looking at whether we are getting more participation in X, Y, and Z. So that's how you can describe what your measure is as related to the learning goal, and without having to have developed, as you're writing your plan, the specific tools that you're going to be using for your measuring. Okay. Another question that I've received is just generally a question about the PowerPoint, and will it be available? And yes, the PowerPoint will be made available. What we're going to do is not only have this on our website with the PowerPoint attached, but we're going to be recording the whole webcast so people can see the presentation and hear the presentation, but we'll also have the PowerPoint available for printing. Okay, and then so there, we have one question, someone that was asking, that was Nicole. Could you type in your question so that we can address your question? I saw you had your hand up. So just a second. I'm sorry, I'm waiting for a question. Nicole, you had your hand up. I was wondering if you could type your question. Oh, okay, Nicole, actually, you've been unmuted now, so could you, you could also speak your question.
Oh, Will?
Yes.
Can you hear me, Will?
Yes, hi, go ahead.
Sorry, this is Wanda. I just wanted to also add in the measurement that the counties need to be sure to include the perspectives of stakeholders in the project measurement.
Yes. Thank you, Wanda.
You're welcome.
Nicole, did you still have a question?
No, that was me.
Oh, okay.
Yeah, Nicole's the one that set this up for us, so.
Okay, okay, great. Thank you. So I'm going to go back to muting you because there's a static in the line.
Okay.
Thanks.
Can you elaborate, please, on that last question?
Oops. Okay, we'll unmute her. But while we're waiting, there, she's just been unmuted. Wanda, did you want to address that question a little further?
Oh, yes, in the project measurement part of your plan and the county's plans, the other thing that you want to be sure to include and to talk a little bit about is how you included the perspectives of your stakeholders in the project measurement section. You know, how were they included in the evaluation, in the measurements? You know, the consumers, family members, providers. So just to be sure you talk a little bit about that in your project measurement section of your plan.
Okay, so Wanda, so I'm guessing, so you're saying that as they describe it, they should explain how perspectives of stakeholders will be included in the measures,
Right.
in the evaluation, right? Okay.
Yes.
Okay, now we have another question, and this is a question: if you're trying to see the impact of a service on recidivism over time, how long would you have to provide the service to get clear outcomes? So this is a question: if your learning is around recidivism, it might seem like that you might need to fund that project for a longer period of time, but what you would do in general with all of these questions in terms of trying to determine how long that you need is to think about what kind of data would you be collecting and how long do you need to learn whether that's working. So you can't fund an innovation for a very long time. So you can't do a question where you're talking about, well, we want to see about this over 20 years. So we're going to fund the innovation over 20 years and see if people come back. And so you want to find a balance in terms of what is reasonable amount of time to find what it is that you want to find. Wanda, did you want to add to that?
Can you hear me?
Yes.
No, I think that was fine.
Oh, okay. I saw your hand up. So.
Oh, no, sorry. I'm trying to get used to using this webcam. I think I need to lower my hand.
I lowered your hand. That's okay. Okay. Are there any other questions before we move into a practical example? You can either raise your hand or type the question in. Okay, so what we're going to be doing next is we'll be allowing Michael Knight to be able to speak. So he will be joining us, and he will be. Oh, whoops! Looks like Wanda has a question again. Yes, Wanda.
No, I'm sorry. I was trying to lower my hand. I'm sorry.
Okay, sorry. Okay, so. As we will unmute Michael Knight, and then he will be able to go into giving us an example from San Bernardino, because we've been giving you a lot of general information, and now what we'd like to do is make it more concrete. So, Michael, go ahead.
Good morning, everybody. How's my sound, Will?
You're doing great. Thanks.
Good, good. Okay. Well, we just wanted to talk a little bit about one of the innovation projects that we submitted, and that's the community resiliency model. First, the project, the essential purpose of this project is to promote interagency collaboration. And how it meets the innovation definition is that we're going to adopt a successful practice or approach that was used in a non-mental health context, and we're going to try and adopt it into a mental health context. So we're going to basically use the community resiliency model. This introduces this new application, and this is something that we were using the Trauma Resource Institute developed a trauma resiliency model that we used for response to wildfires that we had here, response to earthquakes, to natural disasters, things that we've experienced here in our county, some flooding, some landslides, things like that. Things that we experienced in our county, we used this model to go out and basically help people in their time of trauma, in their time of crisis. And this was something that our disaster team actually used as we were using it. As some of the people from our disaster team was using it, we saw that some of our clinicians picked up on it, and they started using it. They started thinking, well, we can use this in our own therapy. We can use this when we're talking with our own consumers. So we kind of had this idea on how we can transform this model that was being used primarily for disaster preparedness and disaster relief into a community model that anybody in the community could use. We know that people their first stop when they're having crisis or trauma is to go talk to their community members, talk to their friends, talk to their family, talk to their clergy, talk to people in the community that they trust. We want to be able to provide information to the community and provide resources to the community that they can actually use. So we're going to transform the model that exists now, and we're going to transform it into something that we hope will be useful for the community at large. I don't know how to. Okay, there we go. Okay, so basically we did have a stakeholder input process. We actually did 46 targeted forms and 5 regional forms specific to innovation. 111 comments came from the prior stakeholder engagement. That was through CSS and PEI. And then 392 comments submitted specifically through the innovations process. The stakeholders they overwhelmingly asked for, they were saying that we had a lack of mental health awareness and understanding of key issues. Understanding it was a key issue for the community. So the barrier that we were experiencing was that we didn't have a culturally appropriate, non-stigmatized methods of providing this education to the community. So by putting it in the community's hands, by giving it to the people in the community, we're hoping that this will reduce stigma and increase access for the system as a whole. So I don't know if you want me to elaborate a little bit more on our community planning process, or?
No, that's okay. Let's go on.
So the community resiliency model, some of the opportunities for learning, the things that we want to know is if the trauma resiliency model, if this can even be adapted, if we can adapt this trauma model into this community model, and if we can, the Department of Behavioral Health, we hope to give this information to other counties. Of course, the project has not been developed yet. We don't know anything about the copyright details, things like that. This was a specific organization that developed this project. So we have to work with them on working out contracts and MOUs, as all of you are well aware. But we would like to share at least our implementation experience with other counties through presentations, reports, and informational sessions. Generally, if the training for the community trainers works and to implement this model and how it works. So we want to know if this portion is going to be successful. How will we know if people are actually using this out in the community? And of course, kind of to piggyback on one of the questions that was asked, we don't really know up front how we're going to measure that. But as the project evolves and as we develop it, this is definitely going to be a way, we're going to definitely try and answer this question one way or the other. How are we going to answer this question at this time? I don't really have an answer, but we're going to develop strategies to answer this question. And then if we're finding out that that it's working, we're hoping to maybe expand this across our county because this county is so large, the largest county in the United States. One of our biggest difficulties is starting a project or a program and then having it go countywide. So one thing that we really wanted to do for innovations was if we were going to test something, if we were going to learn about something, we wanted to do it in a small, manageable setting. Then if these things are successful, then we can obviously look at expanding this out across our whole county. So we want to find out if underserved individuals will attend this type of training in their own community. So churches, community centers, community-based organizations. And we're gonna monitor this by working with these cultural brokers, the people that we are actually training to provide this service. And of course, we're going to be setting up some sort of a tracking system to find out who's utilizing these trainings. And of course, if it's successful, we're going to expand on this train-the-trainer network. So we're going to have more people, of course, across the whole county. A couple more things we want to, if the expansion of the interagency collaboration through new cultural brokers and community ambassadors, if this positively impacts the underserved communities and their participation in mental health. So again, this is going to, throughout this process, we're going to have to do some internal processes that will, for us to be able to monitor if people are coming through our doors because they were referred by one of these cultural brokers, or let's say they went to a cultural broker and the cultural broker did all that they could do for this person, then they were referred over to us. Or maybe the cultural broker calls us to let us know, hey, this person is, this is what's going on, and we need a referral for this person. The person that actually goes to the cultural broker might empower them to work on their behalf. And if that happens, we just want to see if there's partnering happening between the community and these cultural brokers. Then, of course, if this is a successful model, we want to look at exploring options for future funding. Again, additional MHSA funding through CSS and CTI, grants, and partnering with other agencies, departments, and programs. I think because this program is going to be so widespread throughout our community, we'll have a lot of people that are going to have a direct interest in this, and that will want to continue to see it grow and expand. So we're hoping to develop those collaborations and continue to work with them. And we want to know if the training for the community leads to destigmatization. We want to find out if this is increasing access for all of our diverse communities. So we have a very diverse county, and we want to ensure equal access for everybody. So we want to find out if using these cultural brokers, having a diverse group of cultural brokers, will kind of allow us to bridge that gap. So that's pretty much our community resiliency model.
Great, thank you, Michael. It's great to have a concrete understanding of how this innovation might work, especially for such a large county like San Bernardino. And innovation will look different in your county, but I'd like to see if there are any questions for Michael, and also to see, well, let's start there. Let's see if there are any questions for Michael on what they're doing in San Bernardino. Anything on the process in terms of getting his project approved, going through the approval process, and any questions about his planning process. You can raise your hand using the hand-raising feature or you can type in a question. Do you have any questions for Michael? Okay. Michael, we got a question. How much of the CSS and PI input did you use to determine the learning goal?
Well, as I said, we took comments specific from our focus groups and the forums that we did. However, all of this was created through the innovation planning process. We took all the information and we allowed our community to present ideas on innovative approaches that they would like to implement. But what we asked is that they used prior stakeholder input to inform those concepts. So basically, we had an innovations working committee that worked on this project for over a year, and as they were developing these concepts, they were merely looking at prior stakeholder engagement. As you guys know, and as you'll experience, something that Will addressed early on, it was one of the difficulties, one of the barriers that we found was that no matter how much education we did with the community, we were still finding that people were asking for services. We were still finding that people were asking for programs to be implemented and basically to fund programs that were already working and fund things that were already happening. So there was a lot of interpretation that we had to go through while looking at the stakeholder engagement. All of the forums and focus groups that we did, we had to basically translate the information that was given to us from what are they asking for, and why don't we have this already? Very, very similar to what Will already said. So it wasn't necessarily that the prior stakeholder engagement informed the project measurements or the learning goals. It was that we had to kind of almost start from scratch. We had to take the ideas that we got from the community, but really translate them into an innovative process. I hope that makes sense.
Yeah, okay. Betsy, did that answer your question? Or do you have a follow-up question? Okay, so we'll see if anyone else has another question, or if we don't have any more questions for Michael, any other questions in general about the innovation component. So we allowed for enough time for there to be a discussion or questions if people had them, but so we want to make sure that we have give you enough time. And then one of the things that Betsy said is that they've experienced the same thing that you were saying, Michael, that they're encountering some of the same, I think the same challenges in terms of that communities coming forward with needs for services, and how are you shaping that into the learning goal and helping them understand it's a learning goal. You know, one of the things that some counties have said is that when they got that it was about learning, and when finally the stakeholders started getting it was about learning, there was a shift. The planning process became a lot easier. It was like because it had to do with switching from one mode to another mode. And when they were in service planning mode and request for service mode, it might have seemed a lot like CSS and PI planning, where people are trying to present their needs or their requests for services or their ideas for services or their wishes for services. And there might even be somewhat of a competitive spirit around it in terms of people staking their claim on the need for services. But when people finally began to understand that this is an opportunity to really try things and learn things, that can free up a lot of creativity. Now, some counties started with that creativity by how many innovative ideas did you get in San Bernardino?
Well, we took, again, we have 4 projects, but we actually had 17 concepts that were submitted.
17 concepts. So you had 17 people started shaping these ideas, and they submitted 17 concepts. I've heard of counties that had many more, 40 or 50 or 60 ideas that people started submitting. So it's and not all of them are for things to learn. When you get these submissions, you still might get people having ideas in terms of a service that they believe is an innovative service that they want funded. But
right, and I think that if I could speak on that for one second, I think that really was the 17 concepts that were submitted was really a testament to our planning process. We actually used the OAC's tool, their review tool, to develop a concept paper template. And we developed a team of people who were going to review these concepts. And we gave them a scoring sheet, and we gave them a concept paper sheet. So we gave everybody who attended the Innovations Working Committee meeting, we gave them everything that they would need to see. So they knew going through the process whether their project was going to be innovative or not. They knew how our review was going to basically, if it was going to weed out their innovative process, which they thought was innovative or not. So I think that is a real reason why we got less concepts than maybe some of the other counties getting 40 concepts. We stuck very true to the innovations guidelines, and we held people accountable, and we basically went through and graded all of the concepts that were submitted to us. And it wasn't behavioral health staff. This was community members. The Innovations Working Committee actually selected the group that reviewed the first initial concept. So that was something that really helped us weed out a lot of things that seemed weren't necessarily innovative.
Great. So you really helped, in a sense you're saying weed out, but it's like you really helped them understand what it was about. And then you got more quality submissions because people really understood what it was about, right? They got a sense of what you were looking for by having a chance to look at the review tools and the concept paper. Sounds great.
Absolutely.
Great. Okay. That's the end of the main part of the presentation. We have some time to see if there are any other general questions about anything else. Right now, we have OAC staff on the line and DMH staff available as well. And Michael, who's gone through the experience in San Bernardino. So if you have anything else that you would like before we wrap up, either type in your question using the question feature, or raise your hand, and then we'll be able to unmute you so you can ask your question. And I know typing questions might take a little bit of time, so it might help if you're able to raise your hand as well if you were typing a question, so we knew if you're typing. Otherwise, then we'll wrap up the presentation today. Okay, I see no new questions and no hands raised. So I'd like to thank Wanda for joining us and helping out, especially Michael for you taking the time to present about your experience in San Bernardino and the project that you're doing in San Bernardino. And also for OAC and DMH support in general, and trying to really help counties get a sense of what is expected in innovation to help this process go smoother and faster. So we want to encourage you all to contact us either to contact the OAC, staff at the OAC, or to contact me at CIMH as early as possible in the process, because it certainly can be frustrating if you're at the end of the process and you're finding that your project might not meet the guidelines or the criteria. So we want to make sure that you get help early on to minimize a lot of the extra effort that you might have to put in terms of reworking what you're doing. So feel free to contact Deborah Lee at the OAC, Wanda Cato, or Vivian Lee. Here's our contact information, or contact myself, Will Mariscal at CIMH. And for any questions, drafts, ideas, at any stage in the process. This webcast will be made available in a recording on our website, as well as the PowerPoint presentation materials in case you need them for your stakeholders and fellow staff. And also, the software will be sending you a survey for to ask you in terms of an evaluation for this training itself. And we use evaluations to help us make adjustments and know what we need to do for the future in terms of for our quality improvement in terms of the trainings that we provide. So we appreciate if you can take the time to answer the survey when it gets sent to you. And I think that is everything here. So feel free to contact us. And I'll leave the slide up for a while if you want to write down the contact information, if you want to contact us with any question. And I'd like to thank all of you for listening to us today and putting up with the technical difficulties that we had in the beginning with the audio. And we wish that you have a successful innovation planning process and a successful innovation plan, and that you all really find things that will really help transform the way you do services and provide quality services to your community. So we're really excited about all the amazing innovations that have already been submitted and approved, and looking forward to what else is going to be done in California. So thank you for your hard work and your time. Thank you all. That's it. Goodbye. That's the end of our webcast.